This morning, Texas is reopened for business. Texans are back in stores and restaurants, movie theaters, and malls. But in some counties, the number of positive coronavirus cases is going up. Are people safe? We'll ask Dallas County Judge Clay Jenkins. Also, could we lose billions of dollars in sales tax revenue because of the pandemic and possibly face cuts in school funding and teacher pay? Here to talk about the state budget, State Senator Kelly Hancock, who is on the Senate Finance Committee. Plus, VA patients were treated with the controversial drug hydroxychloroquine. The United States Secretary of Veterans Affairs explains and talks about his biggest worry for veterans. And some Texas universities planning to reopen their campuses in the fall, and two of them say they plan to play football when they do. That's a topic on our Reporters Roundtable.
Inside Texas Politics with Jason Whiteley starts now.
Hello and thanks for being with us. I'm Jason Wheeler, in for Jason Whiteley, who is off this week. Before we check in with our first guest today, let's get you caught up on some of the political highlights that we're watching this week. Texas' largest school districts are asking Congress for more help to offset their COVID-19 costs. The ISDs in Austin, Dallas, Fort Worth, Houston, and San Antonio all signed a letter which is asking for $175 billion in coronavirus relief. That's far more than the $13.5 billion that Congress approved last month. The Texas districts are joining the country's largest school districts in signing that letter. We might be watching college football come this fall. Last week, the Texas Tribune reported that the Texas A&M University system is going to reopen campuses next school year and be ready to play football. Texas Tech is also planning to play sports in the fall. Most Texas universities and colleges are planning to open for the fall semester. They have been conducting online-only classes for much of the spring semester because of the coronavirus. Some Texas voters between the ages of 18 and 28 want to vote by mail in upcoming elections. They have filed a lawsuit in federal court now claiming that the state is discriminating against them because of their age. Voters 65 and older can easily request a mail-in ballot, but those younger voters have to meet a very narrow set of requirements to be able to do that. This lawsuit is the latest in an ongoing court battle to open up voting by mail during the coronavirus pandemic. And these voters, by the way, are backed by a foundation that is connected to former U.S. Attorney General Eric Holder.
My executive order to stay at home that was issued last month is set to expire on April the 30th. That executive order has done its job to slow the growth of COVID-19, and I will let it expire as scheduled.
The Texas economy is coming back online again, so here's what is now allowed to open. Restaurants, retail stores, malls, churches, movie theaters, and dentist's office, among others. Keep in mind that libraries and museums are also on this list, but you probably won't find any of those open right now. Along with the rest of the state, Dallas County is beginning to slowly reopen. Dallas County Judge Clay Jenkins is joining us this morning to talk more about that. Good morning, Judge.
Good to be here.
Can you tell me a little bit about this? Because you wanted to wait a few more weeks to get things going once again. Of course, that was big-footed by the governor. His order supersedes here. Give me your thoughts about Dallas County opening back up and how that matches up with the data that you're seeing right now.
Sure. So unfortunately, this last week was our biggest week yet for the most positive cases each day. Before this week, we never had an average of 100 cases a day. You know, for instance, on Friday, we saw 189 cases, and on Thursday, we saw 179 cases. It was also a very deadly week for us. And so what I wanted to do is follow the CDC guidelines and the recommendations of virtually every public health authority and infectious disease epidemiology department at a large hospital in America, which is you want 2 weeks of decline, and then you're able to open up the economy in sections. They strongly encourage you not to open the economy when you are on the rise and you're getting more cases like we are now. And so, that's not anything that I or people in public health wanted. We're going to do the best we can to keep as few people from getting sick in the face of that increased activity while the pandemic is rising.
Judge, if I could here, the White House has recommendations for this, and they say that yes, you should look for that 14-day decline in cases when you're considering reopening. But they say an alternative is a 14-day decline in the percentage of positive tests versus the total tests. Is Dallas County even meeting that standard that you know of right now?
No, unfortunately, we're not meeting any of the standards. Our testing has not appreciably increased yet, and yet we're seeing more positive tests. Also, that White House recommendation, which is mirrored off the CDC, says that you need sufficient testing around those openings, and Texas ranks dead last in testing. And so, unfortunately, even though we've been requesting it for several weeks now, we haven't received that additional testing from the federal or state government that we would need to safely test around this opening.
And of course, testing is going to be a key component of this. The governor had highlighted when he issued this order to allow businesses to reopen that we were going to have to ramp that up quite a bit. And it sounds like, at least in Dallas County, you're not seeing that just yet. Let me ask you this. As we get to the reopening phase here, we've seen the fights happening on social media and, of course, in politics as well. I know that you're very familiar with that. We know that this is a health crisis. We know this is an economic crisis. How did this become so political?
Who knows? And it's not a political situation. This virus doesn't care whether you're a Republican or a Democrat or whether you've ever voted or ever will vote. Look, it's not a time to take your cues from your politics. It's a time to listen to the public health doctors, the CDC, infectious disease doctors, and epidemiologists who have trained their entire adult life to give you the best information in times like these. And so that would be my recommendation. It's beyond your control what the governor does, but you can go to cdc.gov and see what's best for your family and what's best for your business. And you can listen to Dr. Phil Wong, our public health authority, or the heads of infectious disease and epidemiology at the major hospitals. And what they're telling you is limit those unnecessary trips to groups outside your family. Wear your face covering if you must go to the grocery store. And to the extent you want some restaurant food, pick it up, take it home, and eat it.
So what you're saying here basically is even though the economy is opening back up, we still have a lot of personal choice in this and personal responsibility as well. And you can do your best to keep yourself safe with the changing circumstances. Dallas County Judge Clay Jenkins, thanks for being with us this morning and giving this perspective.
Thank you, Jason.
Well, we're in phase one of getting back to what we remember as normal. We can now go to retail stores, restaurants, and malls and practice safe distancing, of course, when we do that. But what happens if we have to shut down again? Let's ask Ross Ramsey with the Texas Tribune, who is in Austin, joining us this morning. Good morning, Ross. What does happen if we have to shut down again?
Well, I mean, it's going to be a big, giant mess if you have to shut down again. The governor is looking at numbers that he thinks justify slowly reopening things. And in fact, if you only open things to 25%, a lot of businesses won't open. They have to operate at full speed. Generally, people have been supportive of the shutdowns, but there is increasing amounts or increasing numbers of people who really think that the lid ought to come off of this thing. So the governor's trying to find a middle ground there, and we'll see how it goes in the next week or so.
Ross, real quickly here, a rare bipartisan moment, the dozens of legislators signing on to a letter demanding that the governor provide more funding and testing for long-term care facilities, as well as more transparency on case and death reporting from those properties. We've seen that in other states. What's going on here?
Well, we don't know. That's the problem, is that we're not getting the reporting. We don't know. We're not getting the reporting from the state, and we don't know what's happening in there. We do know nursing homes are dangerous places right now, and places where this can be an outbreak potential. The families care about it. The people inside certainly care about it, and everybody wants to know what's going on.
All right, we'll keep following that, and we've got a lot more to come. Thanks, Ross, and stay with us. We'll be right back. So what happens when the agency that's helping unemployed Texans is on the verge of running out of money itself? That is no longer just an academic exercise. The Texas Workforce Commission is relatively low on money, but they say they have a plan. And on this week's episode of our Yolitics podcast, the agency's director is telling us how they plan to keep the money flowing to out-of-work Texans. Right now, just point your phone's camera at that QR code on the right side of your screen, take a picture, and it will take you directly to this latest episode. While you're there, be sure to subscribe to Yolitics as well, because a new episode drops every Tuesday and you'll get it automatically. You can also head to WFAA.com/Yolitics to find all of our episodes. Well, as you might imagine right now, Texas is facing a big budget shortfall because of the coronavirus. And joining us this morning to talk more about that is Republican State Senator Kelly Hancock of Fort Worth. Thank you for being with us, Senator.
Absolutely. Thank you, Jason. Good morning to you.
Before we dive into the budget part of this, let's talk about reopening. We have heard some criticisms around the state that it's too early to reopen, but can you talk about how important it is to get this ball rolling and get businesses back open again?
Jason, at some point we've got to get moving on this. We are human creatures. Social interaction is part of who we are. We need one another, and so we need that interaction. And from an economic standpoint, we need that as well. But really, I would say what's more important is that we just need each other. We need interaction with one another. We need those relationships. We need those interactions with our friends and with our family. And right now, we're not able to do that the way we need to. And it's going to impact lives. It's going to impact families. Lack of interaction, that social interaction will create depression and anxiety. And so there's multiple reasons that we at least need to get moving in the right direction.
Yeah, a lot of people arguing with that. They think it's too dangerous right now, but we're going to have to probably just keep a very close eye on what these cases do as the state opens back up and expands that capacity more and more. Let's talk about the budget, though, and specifically sales taxes, which is a huge part of the Texas budget. Those have been hit hard. We know that we've had losses in the billions. We haven't gotten a final figure on that just yet. Can you kind of take a look at that landscape for us right now? And I know that you've always been about limited government and lower taxes. Are we going to see an era of expanded government and possibly higher taxes in this state?
Well, I think if you look at where we are, absolutely, we're going to see sales tax, which is a large part of the revenue for the state, be impacted. We recently just got the numbers from the controller for March, which March, the quarantine wasn't in full effect, and we saw about nearly a 10% decline in the sales tax revenue in March. I suspect when the April numbers come in that we'll see an increase in that direction, a continued decline. I know as a business owner, I'm having to deal with that as well. I've met with all of our employees this morning to talk about April, and it was, April was not a pretty month. We were down quite a bit, and we just had to have an open conversation on that. And so businesses are looking at that. Government's going to have to look at that. But I will say during this time, one of the things we've seen from the governor is we've seen ways to try to spur the economy and keep the economy growing, even in the midst of the pandemic, by deregulating, by limiting the regulations and limiting the rules. And we've seen agencies do that. The governor's done that in order to try to open up the doors of the economy and continue, allowing economic freedom in areas even under this environment. And those are things we're going to have to look at it moving forward, ways to make sure that we do stimulate the economy.
Senator, last thing with about 10 seconds left here. Of course, Texas has about $10 billion in its rainy day fund. Is that going to be enough of a cushion to help us out, or are we likely to see big cuts?
Currently, we have the controller says, our treasury, we are able to cash flow, and we're, we've still got a year to go with the budget we adopted last session. So the way our budget works is when we start session, we've got 6 months left in the previous session's budget. So fortunately, Texas has been very economically successful. We were conservative in our budget. And so Texas, of all the states, is in great position to come out of this thing and be prosperous as we move forward.
All right. State Senator Kelly Hancock, thank you for sharing your thoughts on all this with us this morning.
Appreciate it. Thank you, Jason.
Veterans advocates are demanding answers after the Department of Veterans Affairs used the unproven drug hydroxychloroquine as a treatment for the coronavirus. A preliminary study of veterans hospitalized with COVID-19 showed that the anti-malaria drug had no benefit and actually caused a greater rate of deaths. This morning, Jason Whiteley is asking Robert Wilkie, the U.S. Secretary of Veterans Affairs, about the controversy in a recent interview.
Mr. Secretary, thanks for the time.
Jason, thank you for having me.
The CDC warns there could be another flare-up later this year, potentially, of the coronavirus. Is the VA system able to stock up on supplies yet? Has the supply chain caught up in order to prepare the VA system?
Yeah, we are preparing for that contingency, not just with supplies, but we're stressing the system in terms of telehealth. And why is that important to Texas? I always say the loneliest sign in America is on Interstate 10 in Houston, and it says El Paso 910 miles. There are a lot of politicians up here who don't understand the scope of the scale of the Lone Star State. So in a normal month, Jason, we do 40,000 mental health tele-appointments. In the month of March, we did 154,000. So we are preparing to expand that system should the virus kick back. We have 5,200 veterans across the country who have tested positive. That is out of 9.5 million veterans. The western part of Texas has yet to be hit. Right. The numbers of veterans in San Antonio and Amarillo, Lubbock and Dallas are incredibly low. But I continue to watch that in case there is something that hops the Great River and moves into Texas.
Mr. Secretary, I have seen that sign on I-10, and that's a tough sign to digest when you're just entering Texas there in Orange, Texas. Let me ask you about this. There was talk early on, Mr. Secretary, that the VA system might be opened up to the general public if private hospitals reach capacity. Is that still a contingency plan within the VA?
Well, it's no longer a contingency. It is real, and it's happening today. We opened up our hospitals in the Northeast, in Manhattan, in Brooklyn, in East Orange, New Jersey, in Detroit, Chicago, and Ann Arbor. Once we had taken care of our veterans, we serve as a bridge between the federal government and the states and the localities. So where we can help, we will. What I see as the coming issue for VA is not hospital beds. I think America is fine with hospital beds. I see the coming issue, and it's one that I'll be talking with Texas officials about, and that is nursing homes, particularly state veterans nursing homes. That is where I see our most vulnerable veterans as a group being. So we send in nurses, we send in gerontologists, we disinfect, we help those systems take care of veterans.
Doctors published a study about the hydroxychloroquine drug as well. That was based on case studies inside the VA hospital. I'm curious about your reaction to the results, because it said that the hydroxychloroquine, which the president has touted, is not effective and has actually killed some patients. What's your reaction to those results?
So let's talk about what that was. It was an observational study. It just took a small number of veterans and sadly looked at them in the last hours, maybe last day of their lives. And the drug was given to them as a last measure. So what does that do? First of all, it's not been clinically reviewed or peer reviewed, but I see it as another tool in the toolbox. And particularly because the president has made the use of this drug aspirational. We know that it works on younger people. We know that it has been working on middle-aged people. What we showed is that at a last desperate time in a veteran's life, it sometimes did not work. So I sit as part of the National Task Force with Dr. Fauci and Dr. Birx. We talk about these things. We are trying to do as much as we can in as short a time as possible to see if we can deploy these drugs and if they can be useful.
Secretary Wilkie, thanks for the time.
Thank you, Jason. Thank you for having me.
Okay, so a question. Does the public support Governor Abbott reopening this state? That's a topic on our roundtable coming up next.
This is Inside Texas Politics with Jason Whiteley.
All right, time now for our Reporters Roundtable, and we are one shy today because WFAA political producer Bernadine Steptoe is off this week, but Ross is still with us from the Texas Tribune, and Bud Kennedy is here from the Fort Worth Star-Telegram. Gentlemen, thanks for being here.
Sure.
All right, so let's talk about this. The state reopening once again here. Some have been critical of Governor Abbott. Is the public following him on this, or is he out in front of them? Ross, let's start with you.
You know, I think some people are ready to get out. He's not saying you have to go out. He's not saying businesses have to open. So the people who are uncomfortable with it can decide not to play. But, you know, it's going to be an interesting first week or two.
Jason, the leadership's been good on this. It's the messaging that's been confusing. People have been told, wash your hands, flatten the curve, stay home, stay 6 feet away, wear a mask, and now open Texas. It's like people are told all these different things to do. They don't really know what to do. They just kind of thrown up their hands and said, okay, we're going out.
Let's talk about schools here now, both of you. Texas A&M and Texas Tech are going to open their campuses and football this fall, they say. Baylor University, Texas Women's University, already announcing they're going to resume on-campus classes as well as the University of Texas. What do you all think about this? Is this realistic that we're going to see campuses reopen, and especially football again, Russ?
You know, the earliest one is going to be Texas State. They just announced that on Friday, that they're going to open some classes in midsummer. We'll see. You know, I think it's going to be interesting to see how they configure the classes, whether they've got students sitting next to each other. It's going to be very interesting to see how they configure stadiums and whether people want to go sit in the stands and eat a hot dog sitting right next to a stranger.
Bud, what do you think?
Well, that's the question. They're selling the college experience. They're selling football, fraternities, parties, social activity, as well as education. You know, we're going to have to see how many students want to come back, if they're going to have to sit, if we're going to have to wear more face masks, stay 6 feet away, avoid gatherings. We're going to see whether students want to follow those rules.
All right, Bud gets the final word on that one. Gentlemen, thank you both, and thank you at home for watching as well. We'll see you right here again next Sunday on Inside Texas Politics.